Another thing I had never really thought of until I got sick, or really realized after I got sick, is I think when you're reading books or seeing movies or whatever, and somebody gets sick and then they either die or they are healed and everything is all better. And it didn't occur to me that there's actually a third path where they are better, but they are never the same. My name is Laura. I'm from Alexandria, Virginia. I was diagnosed with Hodgkin's lymphoma in 2017, and I've been in remission since 2018. I came into the doctor's office with a nagging cough, and so I thought that I had pneumonia and some antibiotics would take care of it, and it turned out to not be the case. Instead, they wanted me to get a CT, and I was upset by this, but sure, fine. I don't I don't love all these medical procedures, but sure, I will do the things so that you can give me the antibiotics so that I can finally knock this cough out. And instead, I got the call, come to the doctor's office. And like, that's not good. And so I go into the doctor's office and they tell me I have cancer in my lungs. And that started the process very fast where my I have I get a uh I get a pulmonologist, I get an oncologist, I get all of these gists that for somebody that thought of myself as being a healthy person, I hadn't been to the hospital since I broke my arm when I was a kid. I was on no medications. I was not used to the medical world at all. And then they dropped this bomb on me that I thought I was a healthy vegetarian yoga practicing 40-year-old woman, and now I'm a cancer patient. And not only do they say I have cancer in my lungs, I have cancer in both lungs, which, as I do a lot of googling, that's stage 4. And it's not good if you Google that. And so they tell me it's lung cancer, but that I need yet more tests. They need to check to see if it's in my bones, if it's in my brain, how far in my body it's spread. So I enter the medical world and I go through all these tests. I have all these specialists, and I still can't really get my head around the fact that I'm a healthy person with a cough and I am dying. And so it turns out I am incredibly fortunate to be a zebra, that yes, there's cancer in both my lungs, but it was not lung cancer. It was lymphoma, Hodgkin's lymphoma, which is treatable and curable, even in stage 4, even when it's spread everywhere. So I spend a couple weeks thinking I have terminal cancer, and it turns out instead it is treatable and curable even in the advanced stage, which I had. So I was the happiest cancer patient that I think a lot of my doctors had ever seen, because I was not expecting to live, and then it turns out that I have a chance. I have a good chance. I was tired, but I mean, that doesn't necessarily mean anything. And there was a rash on my leg that never really went away, and that was just annoying. And so there was nothing I considered serious. But the cough that never went away, I was planning to go to New York. So I wanted a round of antibiotics to fix it before I got to New York. And then it turned out it was way more than just a cough. So I had lung biopsy. They got some of the tumors to test. And that's when they told me it was consistent with Hodgkin's lymphoma, not lung cancer, but they didn't have enough to be sure. So that's when I had the mediastinoscopy. So when they cut here and took a big chunk, I guess, enough to be sure. I was in the hospital for a few days for that. And my insurance company was refusing to cover it at first. So I had to fight a $100,000 medical bill while going through the initial stages of cancer treatment. And eventually, my appeals were successful and my insurance company did cover it. But that was just an additional thing I had to deal with while dealing with everything else. When I was finally diagnosed, Hodgkin's lymphoma has a well known, well tested treatment protocol that has very good results. And so I went through the standard protocol in 2017, which was 4 chemo drugs for 6 months, and then a month of radiation to consolidate after that. If I had been going through it now, I believe the chemo regimen would be a little bit different. There might be an immunotherapy component to it. I don't know if the radiation would, if the radiation protocol would change or be any different. But at the time, I had a standard case of a standard cancer that they mostly know how to treat and cure. And so I did all the standard things. For the chemo, I was surprised to not be nauseous because, when you see all the TV shows and read all the books, my understanding of chemo is that you lose all your hair and you're throwing up all the time. So one of those happened to me. My hair was mostly gone. And I was surprised I didn't realize this, that when you lose your hair, you lose your hair everywhere. So, like, I had hardly any eyebrows. My eyelashes were gone, like head to toe, everywhere you grow hair, that hair is gone. So, didn't have to shave for several months, so that was nice. But not really nauseous. And so every chemo session, they part of the chemo, with the chemo drugs, they also would give you anti-nausea meds. And so I don't know if that was enough, or if I'm just lucky, or if it was the particular drugs that I was on didn't cause that. But the main side effects for me were being hairless, and my mouth got really, really sore. Like a day or so after a chemo session, my mouth would just be on fire, and I would just keep eating popsicles and just wait it out. But there wasn't much else I could do other than that, as just sort of be in mouth agony for a while. So, radiation to my mediastinum, but there was no surface burns or anything. So I had no side effects from the radiation, just the chemo side effects when I was going through that. And I was also tired. I was very tired during the chemo. There were a couple challenges. The first challenge was dealing with insurance not covering my first hospitalization and then having to fight the $100,000 medical bill. I got hospitalized again after my first chemotherapy session. My doctor wanted to give me a drug to help my immune system recover faster, and insurance denied that. And instead, I got an infection and I wound up in the hospital for a week. So that was not great. Steroids blew up my face like a balloon, and I spent a week in the hospital trying to recover. And hospitals are not restful places. I do not recommend. So 2 hospitalizations, had to fight insurance to cover the first one. The second one was caused sort of by the insurance refusing to cover the legitimately ridiculously high cost of the prescription drug. But the other thing is, all while this is happening, this is spring, summer, fall of 2017, and my insurance was through the Affordable Care Act, which Congress was trying to dismantle. So underneath all of this, I have to be concerned whether I'll even keep the insurance that is keeping me alive and is going to pay for my cure. Another thing I had never really thought of until I got sick, or really realized after I got sick, is I think when you're reading books or seeing movies or whatever, and somebody gets sick and then they either die or they are healed and everything is all better. And it didn't occur to me that there's actually a third path where they are better, but they are never the same. And all I need to do is look down at my scars, and I will never be the same. And I don't even know what all the effects are of everything I went through. I know I have elevated risk of secondary cancers, of lung problems, of heart problems because of the chemo and the radiation, which was important to do at the time because obviously I'm a big fan of being alive. But I don't know what's going to happen to me in 10 years and 20 years, what things are going to break because of those treatments, which again, I didn't really have a choice. So it is what it is. But I can't go back to it. It doesn't work like you go through chemotherapy and then you're 100% all better and it's like it never happened, because it happened and it changes you uh, irrevocably. But also add to that, I am not 40 years old anymore. Now I'm almost 50. And so sometimes it's difficult for me to parse out, when I get up in the morning, when I, stand on the ground for the first time, my feet tingle a little bit. It's unpleasant. And is that neuropathy from chemo? Is that because I'm almost 50? It can be hard to tell what is the difference between getting older, things that would have happened anyways, and what is a result of everything that my body has been through. The first 5 years, I had an oncologist. For the first 5 years after they declared me in remission, which was about it was March of 2018, and I was diagnosed in April of 2017. So it was about a year, a little bit less. So went through all the things during 2017, and then they did the PET scan. They declared me in remission in early spring of 2018, and so 5 years after that, I had an oncologist. I would get regular checkups and blood work. I had a cardiologist that was checking me for heart issues related to all of this. I don't have those things anymore. I also don't have any problems that I am aware of at this particular moment. So I graduated from having an oncologist. Um, but I wish that there was some sort of cancer clinic here in Virginia. I went through treatment in Nevada, and then I moved to Colorado, and I was a part of a great research institute in Colorado, where again they had cancer clinics and they had cardiologists that specialized in cancer patients and so on. They had all of that infrastructure. I don't have that here. It might exist. I don't know if I need it right now. But that was another thing that really surprised me going through cancer, is that when you're done with treatment, they're like, good luck, see ya. And it was so strange to go from, clocking in every week at the cancer center for chemo or follow ups in chemo, clocking in every day for radiation treatments, to nothing. And what are you supposed to do next? I imagine it's probably a little bit like if you have a baby and you leave the hospital and they're like, good luck. I have a lot of friends that are still in treatment or their treatment didn't work, etc. So I am incredibly grateful that I graduated from my oncologist. I'm not in treatment. That, as far as I can tell, I am mostly like other people in terms of risks and so on. Uh, but uh, I feel like anybody that is still here is a survivor. Sometimes you're a survivor of cancer, sometimes you're a survivor with cancer, but you're here surviving regardless. So I am just incredibly fortunate that my type of cancer is one they learned, for the most part, how to treat and cure in the 70s. My first message would be, you don't have to do this alone. Even if you are in a place that doesn't have a lot of infrastructure for cancer patients or whatever you're dealing with, there are online support groups and online options, and you can find other patients to talk to, and that will be so helpful for you. Before my first chemotherapy session, I Googled the chemo regimen that I was on, the drugs that they were going to give me, and I found a Hodgkin's survivor that talked about the 4 drugs, how she reacted to them. Things like, sip on a popsicle during one of the drugs to avoid mouth sores. And just having somebody who's been through it talk me through what it's going to look like, what to expect. Uh, the mystery part is one of the scariest parts. So that was incredibly helpful for me. And I hope for everybody listening that whatever you're going through, if you Google, you will find some things that you should not pay any attention to, but you will find some good advice and tips. And you will find other people that have been through what you're going through, and that will hopefully help talk you through it. So that's one message of hope, I think. And another is that uh, you are not your disease. This is a thing that's happening to you, but bad things happen to good people, bad people. Good things happen to everybody. This is not a judgment on you that something bad has happened to you. So you are not your disease. This is not some sort of punishment. You didn't. Nobody deserves this, but unfortunately, this happens to some of us. And do your best. Do the online research. Take it with a grain of salt, because some of it is more valid than others, but you do not have to do this alone. You are not alone. That even if you have an incredibly rare disease, you probably are not the only person in the world with that condition. Maybe it's only 5 other people, but thanks to the internet, you can find those 5 other people, and you don't have to be alone.